everyone, I'm Daisy of Group 2. Today, I'm going to show you how to wash your hands properly based on the World Health Organization technique. First, with hands with water. Apply enough soap to cover all the hand surface. Rub hands palm to palm, right palm over left dorsum with interlace fingers and vice versa. Palm to palm with finger interlace, back and fingers to opposing palm with fingers interlock. Rotational rubbing or left palm in right palm and vice versa. Rotational rubbing backward and forward with glove, with fingers of right hand in left palm and vice versa. Rinse hands with water. Dry thoroughly with a single-use towel. Use towel to turn opposite. Your hands now are safe. Thank you for watching. Hi everyone, I'm Daisy Pones from Group 2. Today, I'm going to show you how to don sterile gloves. The first thing we want to do is wash your hands. Then select the pair of gloves that would fit you because these come in various sizes. Once you have your gloves, you will open them up like that. And you will notice these little flaps. These flaps will assist you in opening up the gloves so you won't contaminate them. So just put your fingers underneath them and just pull it up, open. And remember, you have 2 inches to grab around this field and you don't want to cross it 2 inches because you will contaminate the field. So just go around and open up gently the gloves. You have your right glove and your left glove. These are the cups which will be touching and will become unsterile. We do not want to touch the outer part of the glove. So first, what we're going to do is glove our dominant hand. My dominant hand is my right hand, so I'm going to glove that first. What I'm going to do next is I'll take my left hand and I'm going to grab the cup of the right part of the glove and I will slide my hand into the glove. I'm going to slightly tuck my thumb so it will be easier getting my glove on. So I get the cup and I'm going to slide my hand in and then just put my fingers up. Just roll the cup down, making sure I don't touch the outer part, just so it slides up my arm. Now this is sterile. Do not touch anything other than what you are going to do with this glove because it will become contaminated. Now I'm going to simply take my fingers underneath the left glove and get under there so I can glove my left hand. Make sure I keep this thumb away because I'm going to slide it over my left hand. I'm going to slide this, just tuck my thumb in again and just slide it underneath the glove. And I'm pushing with this part of the glove so that it will go over my hand and gently roll it down without touching my arm, and I have the gloves on and they are sterile. Now I'm ready to perform my procedure. Thanks for watching. This is your guide to wearing personal protective equipment as a member of the home care team. You play a valuable role taking steps to keep yourself and others around you safe and healthy is really important. There are many kinds of viruses and other germs in the home care setting with where you work, and you can always tell them people are sick. Even people who look and feel well can be contagious, exposing others to infection. Wearing personal protective equipment or PPE is essential to protect yourself, your clients and consumers, and your family and friends from COVID-19, influenza, strep, and other diseases. Knowing how to put on a removed PPE correctly is the best way to prevent viruses and others germs from infecting you and the people you come in contact with. The good news is putting on a removing protective gear is not difficult. Following some important steps each and every time will help ensure you get it right. You can do this. So let's get started. This is Daisy Pones and I'll show you how it's done. First, let's review the protective gear you may need to have with you when visiting a client or consumer employer. Depending on the situation, You may not need to wear every piece of the PPE we're about to show you. Your supervisor or consumer employer will tell you what types of PPE to wear, generally speaking. It may include some or all of the following items: a disposable gown or jumpsuit to cover your body and arms. Make sure this is the correct size for you. A face mask or a respirator, either a face shield or goggles, coverings for your head or your shoes, and gloves, in addition to protective gear. You will need a hand sanitizer when putting on and taking off your PPE. It's a good idea to have a clean trash bags on hand for disposing of your PPE after use. Make sure you put on your protective gear before you enter the client or consumer's home, or if in a care facility before you enter the room. Set up your trash bag now so you'll be ready to dispose of your PPE later. If you didn't leave your PPE at home, remove it now so it won't tear your gloves. Remember that good hand hygiene includes keeping fingernails closely trimmed and not wearing artificial nails. Start by cleaning your hands thoroughly with sanitizer. Squeeze a generous amount of hand sanitizer in your hand about the size of a quarter. Rub your hand together for at least 20 seconds until your hands feel dry. Singing happy birthday twice is one way to make sure you're taking the full 20 seconds. It may seem like a long time, but it's necessary to make sure you're eliminating germs that could make people sick. Next, put on the gown or jumpsuit. For the gown, place your arms through the first. Then, secure all the ties. Make sure your gown covers from your neck to your knees. As well as your back. If using a head covering, put that on now. Make sure you tuck your hair completely under the head covering. Now, you're ready to put on a clean face mask or respirator. There are many different styles of face masks. You will use what your supervisor or consumer employer has supplied for you. Place the face mask over your nose and mouth and secure the elastics around your ears. Make sure the mask covers your nose and extends below your chin. If it has a flexible band for your nose, gently press your feet this to your face. If using a respirator, put it on as instructed when you were fitted with the respirator. If you are using eye protection, put that on next. For goggles, make sure they provide coverage around your eyes. If using a face shield, it should cover your face entirely. Put shoe coverings on next if you are using them. We're almost done. But before you put on your gloves, clean your hands again for 20 seconds. Finally, put on your gloves. Pull the gloves up fully until they cover the rest of your gown. That's it. You're now ready to enter the home or room. Now let's review a best practice for safely taking off or doffing your PPE. This should be done outside the residence. Start by removing your gloves. It's important to do this in a way that avoid contact of your skin with the outside of the glove to prevent viruses or other germs from getting on your hands. Pinch the outside of the glove near your wrist. Peel the gloves downwards, pulling the gloves inside out. With your ungloved hand, slide a finger under the wrist of the other glove. Again, hold down, turning the glove inside out, then dispose the gloves. If you're wearing a jumpsuit or gown, remove it next. For the gown, start by undoing the ties at the neck and back. Then reach up to shoulder and carefully pull the gown down away from your body. Touch only the inside surface. Roll the gown up tightly, then dispose it. At this point, clean your hands again for 20 seconds. If using a face shield or goggles, remove that next. For the face shield, carefully grab the strap and pull upwards and away from your head. Avoid touching the front of the face shield or goggles. You will need to disinfect this before your next appointment. If you're wearing a head covering, remove it now. If you will be cleaning and reusing it, place it in a separate bag. If using shoe coverings, remove them now. Your hands again for 20 seconds. Next, remove your face mask or respirator. Unhook the plastic from your ears and carefully pull the mask or respirator away from your face. Make sure not to touch the front of the mask. You're now ready to move on to your next client. I've shown you the basics now. It's up to you. Practice putting on and removing your PPE to get familiar with doing it properly. Take your time in putting your PPE on and taking it off. Don't take shortcuts. And remember, change your gloves and wash your hands as frequently as you need to during your visit. Doing this correctly, each and every time, you won't pass viruses and other germs to others, including your family and friends. After all, keep people safe and healthy is what it's all about. Remember, your community is counting on you. You got this.